Hundreds of thousands of schoolchildren in rural parts of northern India have problems with their eyesight and are in urgent need of help. Now a charity called ORBIS is funding eye tests in the region so they can spot eye disease early and try to prevent children from going blind.
We know that if you can give a child back their sight and if you can identify things early, then they have a much better chance of having an education and working their way out of poverty.
India has more blind children than any other country, according to the charity. But most eye clinics are in towns and cities, and families living in the countryside can't afford to go there. So eye specialists from the city of Moradabad in Uttar Pradesh have decided to come to them, on board this specially adapted bus. The Vision van was donated by a charity called the Wicker's World Foundation. At this girls' school, about an hour from the city, there are more than 600 children. Around 90 of them have visited the bus, where they have their eyes tested by experts called ophthalmologists.
It was an E on the chart, but it was blurry. I felt anxious when I couldn't read from the chart clearly.
The state of Uttar Pradesh has a population of about 200 million people. It's home to the famous Taj Mahal. The river Ganges, a very sacred place for the Hindu population, also runs through Uttar Pradesh. But the area is extremely poor, and few people here can afford medical treatment. Teachers carry out basic eye tests in schools to find out which children need to see the eye experts when the Vision van visits them. The eye hospital and charities are especially keen to visit girls' schools, as girls here are not always seen as being as important as boys.
There is a huge problem about women being always at the lower end of receiving the healthcare facilities.
Sarish was finding school difficult because of her eyesight, and it was making her unhappy.
I felt sad. I couldn't see clearly. Everything was blurry.
Now she's been given glasses and can see to read and write. Some children, like Sunny, need an operation to see properly again. But his family can't afford to pay for treatment themselves. Luckily, the charity was able to pay for Sunny to travel to the eye clinic in Moradabad and remove the cataract, which was covering his eye, making it hard for him to see.
This child gained around the 90% of the vision, and after 1 week, I think the vision will be the 100% or the 99%.
These children are the lucky ones. But doctors here hope to screen as many children as possible before they get to school, giving them the best chance of reducing childhood blindness and the best opportunity to learn.